Hello, thank you for joining us. My name is David Barker, and I'm here with Dr. Shana. And today's webinar is all about
attention deficit / hyperactivity disorder. That's a mouthful, and I propose to start explaining what it is. I'm taking this as a topic after 5 episodes focused on people's troubles with coronavirus, because I think that the families who have a child with attention deficit / hyperactivity disorder must be having a hard time if both parents are at home and all the other kids are at home, and this particular mental illness, which strikes young children, would be particularly difficult to be in a confined space with. Mm-hmm. Let me first explain what it is. Attention deficit, the word deficit means that there is a lack, something missing. Just as when they talk about our state budgets, they say there's going to be a deficit this year. What they mean is that the amount of money that the state has coming in will be less than the amount going out because of the coronavirus difficulty. And so that's what's called a deficit. Attention deficit means that the child cannot really pay attention. And so this has several implications. One is you never give this child an instruction without making it in very few words that are simple words, and you get the child to repeat what was the instruction after you've said it. And if they can't repeat it, that was because they had a deficit of attention, and you're going to have to say it again and try a little harder to get it across.
I've got a question. When you say a deficit of attention, is it more that their attention is elsewhere, or they just can't attend? They just can't attend to anything?
They can't attend. It's not a question of they're paying attention to something else. Although that's a good point. If somebody is, say, playing a game, you're going to have to get them away from thinking about the next move in the game before you even have a chance to give them an instruction. And the other thing is, you should give them short instructions. It's much better for an attention deficit child to say, put your dirty shirt from yesterday, which I have here, in the dirty laundry hamper. And then wait till the child does it and say, now take the cup from which I or your father or somebody drank this morning and put that in the kitchen sink. You don't try and tell them to put the dirty shirt in the hamper and put the cup in the sink, because they might do the reverse. They might put the cup in the hamper and because they can't they don't have a normal ability to attend to what you say. And it's always best to have them repeat what you just said.
We were talking earlier, and you had a story about a woman and
Yes, I know. I'll get to that.
okay.
But now, first of all, I'll tell you there are 3 types of this disorder. The most common is a combination of attention deficit, which I just described, and hyperactivity, which is in its worst form is an inability to sit still. They've just got to keep moving, and they may run around a classroom. The next is attention deficit without hyperactivity, which many teachers see as somebody who's always daydreaming because they're not paying attention, but they don't think in terms of the attention deficit disorder. Then there are also children with hyperactivity only. It's much harder to detect an attention deficit in a child who sits perfectly calmly unless you keep checking up on them. Now, there are special techniques for teaching such children, but I'm not a teacher. I never was, and I don't know a lot of details about that. And it is also true that in order for the diagnosis of attention deficit to be established, it has to apply in any context that the child can be seen. In other words, now this is a story that you wanted me to tell. As I have told my viewers many times, I had temporary contracts because I was, in essence, replacing someone who had to be out of work for a while, either because he had an illness or because they needed family leave or something like that. Something that comes up fairly suddenly and lasts, they might say in the beginning that it's going to last for 3 months, but at the end of 2 months, the guy's ready to come back. But I knew that I saw a child with attention deficit, and he was brought in by his father's mother, his grandmother. And he was a very calm, quiet, delightful child. And I couldn't see where did anybody get a diagnosis of attention deficit or hyperactivity with this child. The grandmother was a stand-in, so I didn't want to change the diagnosis in her presence and get the child's mother all confused. So I waited till the next time that the child was brought to see me, but the mother was so uncalm and angry and put out and very difficult to get along with, and I knew that I would be gone by the next time the child had an appointment. So I didn't want to rock the boat still further by telling his mother that this is not a child with attention deficit. And I'm not happy to say that I played along with the idea. Although any child who can be calm in the presence of any particular adult, his grandmother was a very calm, quiet, accepting sort of person. And his mother was anything but. She was angry with everybody and always out of sorts, and she would make any young child's behavior be not so good.
So how is the child behaving with the mother when the mother brought her son?
Well, he wouldn't pay attention to what adults said, and he was very restless and inclined to get up and run around the room. Something about his mother's attitude just, I think, aggravated him to the point where sitting calmly and letting her say what she wanted to say was just not in his possibility. You have to realize that most children diagnosed with attention deficit, usually it happens when they're in school for whether it's in anywhere from nursery school to first or second grade, that there are restrictions put on, you're supposed to sit here and listen to the teacher. And he couldn't do that when his mother was along. I must say, I found his mother very difficult to deal with myself. But it seemed to me that the one who needed a psychiatrist's help and attention was Mom, not this child. And I'm sorry that because I knew I would not be there when the child came back, that I went along with the idea, and I did try and reduce the dose of the stimulant medication that the child was being given. Now, this is rather strange. A medication which in a normal child will make them speed up and really be impossible, in an attention deficit child, it makes them calm down. And sometimes, if the diagnosis is in doubt, we try the stimulant medication, and within a day or two, the parents will call and say, he's a perfect little hellion. He practically crawls on the ceiling. And then we know this is not a child with attention deficit. Whereas if the parents call and say, he's perfectly calm, he sits in his chair, and the stimulant medication has calmed him down, then we know the diagnosis was correct. But I'm just saying to parents who may have several children at home, and they're at home, and this child keeps running around and disturbing everybody, that for what it's worth, he or she, it's more often a boy than a girl, may not be able to pay attention. So it's a deficit of their capacity. It's not necessarily willful disobedience or something like that. And so one thing that does help is to put them in a room where there's very little furniture, very little things for them to pick up, and very little to stimulate their mind, because what we're looking for is for them to calm down. And some parents find it useful to tell them to go to that room for 15 or 20 minutes before they serve a meal to the family, so that the attention deficit child won't be, taking the milk from the child who's sitting next to them, or, doing many sorts of inappropriate things because they're overstimulated. The stimulant medication that we have does work. The unfortunate thing is that many providers do not check, is this child also hyperactive and attention deficit and the whole thing, when they're with their grandparents or when they're with their next door neighbor or anything else. Because if there's one person who can get them to calm down from inside themselves, then they don't have attention deficit disorder. I have a nephew who had attention deficit disorder when he was a young child, and like many children, as he approached adolescence, he grew out of it, which was a blessing, and he didn't need his stimulant medication anymore. And the major inconvenience of the stimulant medication is that it may reduce the child's adult height by maybe 10%. Now, my nephew is 6'3", so if he was going to be 7 feet tall, well, he never had a leaning toward basketball anyway, and maybe 6'3" is a better idea than 7 feet, unless you're going to have a basketball career. But we stopped it as soon as he began to calm down. The thing is, most kids have to take their stimulant medication in the morning and in the afternoon. And if you notice that they take it late in the afternoon, but they don't go crazy with running around or being unable to attend as soon as their morning dose wears off, you can start to think, well, maybe we'll reduce the dose slowly. You don't stop it at one go. There are very few psychiatric medications that it is a good idea to stop between one dose and the next, because if it's too much of a shock to the brain, but as I said, he grew out of it, so he was one of the lucky ones. There are people who go on to adulthood with attention deficit disorder, and I discovered something rather interesting about these people, which is that they may get a job which has several components to it. Maybe they have to maintain a list of something, and they have to do various clerical tasks. Whereas you or I might say, okay, I'm going to do this task from A to Z and be done with it and cross that off and then go on to my second task. They will be inclined to do 3 entries in their first task and then move on to their second task and then their third and their fourth, and then go back to the first task. But by shifting what they're supposed to pay attention to, that seems to help their attention deficit. And as long as at the end of the day or at the end of the week everything's done and it's done well, that's not a problem. It can just become a problem if their supervisor says, why did you do the first 3 on this and then switch to task number 2 and then switch to task number 3? And if the supervisor doesn't understand about attention deficit, that can be a problem, because supervisors may be inclined to think he must not be paying adequate attention to what he's doing, because they think, well, he's just bored and he just wants to change for the sake of change. But they don't realize that for an attention deficit person to do one task and then in a few minutes switch to task number 2 makes sense, because they don't do well if you make them do task number 1 all day long. It just doesn't go well.
So how did you end up treating the mother instead of her child?
Well, I didn't end up treating the mother. I went along with the idea that her child had a problem. I did suggest that she was obviously worked up and upset, that she might want to have some treatment herself to be able to cope with this rather unusual problem at home. But she simply said, "There's nothing wrong with me. It's my boy that's all messed up." And that was right in front of the boy. And the way she said all messed up, I mean, she blamed him for everything that happened. She blamed him for her distractibility. If she, say, went to a grocery store without her credit card, she'd say, "Oh, he was distracting me, so of course I forgot it," and made everything into his fault, which is not a good technique for anybody. Everybody needs to take responsibility for whatever contribution to a mix-up they made. And I did suggest to her that she might want somebody to help her calm down. And I confess I also thought, well, at least this little boy has this wonderful grandmother who is very accepting and doesn't criticize him for the sorts of things that any 6-year-old can get in trouble for. She understood, for example, that if she left a plate full of freshly baked cookies on the counter, he would take a couple. I mean, that's just normal childhood behavior. So if she were trying to keep a dozen cookies for a meeting at church next week, put them in a jar and put the jar at the very back of the shelf so he won't see them. Anyway, that's what I wanted to have people understand, and it's also very helpful if you tell the other children to observe what the attention deficit child does, but not to be critical or nasty. I'm speaking now of a child who genuinely does have attention deficit. And you can help the grown-ups by telling such things as, okay, he takes his morning dose at 7:30 a.m., and when does it wear off? Because that's very useful information. Anyway, if anybody has a topic that they would like to hear, my website is Dr. D-O-C-T-O-R, Shana, S-H-A-N-A, .net. I will also tell you that I have written and published 2 books one of which, and they're both about how to live well. One of them is called My Money's on the Turtle. It's a play on the old fable of a race between a tortoise and a hare. And we all know the tortoise won because he was persistent, whereas the hare didn't really think this was a race, and so he kept stopping and not paying attention to the idea that he was in a race. And the other one is called Taming the Dragon, and it's lots of information that anybody who has mental illness would need. It's half of the information is about how the mental health system works. And so it's about how to navigate the mental health system to a happy result. And that's called Taming the Dragon. And I'm rather proud of myself because it's a book over 400 pages, and the retail price is $12.99, which is a steal for that length of book.
Would someone be able to email you and purchase it directly from you?
No, unfortunately, and particularly the Taming the Dragon should be purchased online, either from Amazon or from Books A Million or from Barnes and Noble online. It is not available in bookstores because the bookstores require a hefty discount on the price, and with the full bookstore discount, there wouldn't be any money left for me. And while I never set out to make a fortune with these books, I would like to make back the cost of producing the book, which means a small royalty on each copy sold. So I'll see you, or I will communicate with you. I have to be careful. I wouldn't see you next week. And anybody who would like to have me discuss a particular topic or a particular problem, all you have to do is put it on my website. There's a section called Contact Us, and all you have to do, I would ask you to put your first name and the first letter of your last name, because there may be other people named Anne or Mary, or other people named John or Bob. So, and I also would like to know, just out of curiosity, what part of the country you were in. So, hope to hear from some of you before next week, and have a good week until then. I know many of us are sort of waiting for life to restart, and that's difficult. But it's better to wait for life to restart than to have many more of our relatives, neighbors, and friends die of this awful pandemic. So, I hope you'll be listening next week, and have a good week. Bye bye.